Hi, my name is Dr. Michael Cohen, and welcome back to What's Up Doc, the channel where we question medicine.
How much can our daily actions and behaviours affect our health?
I think hugely so. I think probably the greatest determinant of our own health is the time and the efforts that we invest in ourselves. I think right now about a patient who came to me probably about a year ago, fairly young guy, and he was overweight quite significantly. He was smoking and he was on the way to having diabetes, and his blood pressure was up as well. I remember just sitting down with him for a bit, trying to listen to him, try to understand his lifestyle. And I remember telling him a few bits of information, a bit of encouragement. And then 6 months later, he'd come back having stopped smoking. He'd lost 14 kilos in weight. His blood pressure had gone back to normal just as a result of the weight loss. And his blood glucose had also gone back to normal. So this was really quite a striking example to me of somebody who I just spent a bit of extra time talking with, and had seen that he was able himself to make huge changes in his life, which would have ramifications, good ramifications for the rest of his life if he could just maintain that.
How much time should a doctor invest in promoting behavioural changes?
I think that one of the problems today is that we all seem to think that we have no time to do so. Appointment slots seem to be short, and we're under a lot of different pressures. But I think really we need to stop and look and stand back and look at the bigger picture. And if we actually invest wisely and accurately in the time that we do have with our patients, I think we can actually make a very significant impact with the very little time that we often have. I think that we must start moving in this direction if we're going to actually effect a positive change in the behavior and the health of people. Otherwise, we're just going to end up patching problems the whole time rather than treating the underlying causes. As a GP, as a family doctor, we classically have anywhere between 7 and 10 minutes, and this is a fairly universal time slot around the world. There are times when it's much less and there are times when it's more, depending on how flexible we're able to be with our timetables. I think that even 5 minutes sometimes spent properly with a patient can make a huge difference in the way a person responds to the messages that we're trying to encourage.
What is the doctor's role in improving its patients' awareness?
I think we need to bring patients to reality, to see things as they are. We need to listen very actively to our patients with understanding, with compassion, but we also need to prod them and poke them gently. And I think that often patients thank their doctors when the doctor does not fudge the issues, but actually gets to the heart of the matter, tells a person the situation as it is, tells them what they need to really know to make a difference. Not everyone's always ready to hear it, but sometimes we need to do it through repeated messages and messages in different ways and different times. But I think overall, many people do take on board what their doctor says if they've got a reasonable relationship with them. And I think that this really does have a significant effect on the choices and the discipline that a patient decides to take upon himself to effect change. I've certainly seen this year after year with many different patients over the years. So I'm just thinking, a while back, a young patient came to see me. I'd seen them a couple of years earlier, and I saw them again. They actually live in a different country, and they came to see me over here. And they'd come basically telling me that they'd been very depressed for a long time, had virtually no motivation to do very much. Everything was a strain. They were on a couple of different psychiatric medications for depression and anxiety. And when I listened and we spoke further, I sort of gained a good rapport with this patient. And they started to tell me, when I asked them more detailed questions about how much alcohol they were drinking. They were drinking quite a significant amount, and I wouldn't say that they were addicted, but they were using quite a lot of alcohol, and this in itself creates interactions with their medications, and alcohol itself is a depressant drug. And they just didn't know this. So speaking about this in detail with them, they started to understand that actually they needed to cut down on their alcohol very dramatically. And he did. And the effect was that he started feeling much better. His medications actually started working. And this was a very clear indication to me that the time that we spend with our patients, if we focus it well, can have a huge effect on the outcome for a patient. In another patient, it might be that they'd actually stop the medications, but in this particular case, we had a very good outcome just from bringing up the subject of the alcohol.
Can medications replace behavioral changes?
I think that medications have a very important place, but they usually have their best effect in acute situations. And these are times when we can't easily replace medications. There are many examples of this in an emergency situation, or if someone has a bacterial infection, they may need antibiotics or whatnot, they may need steroids. However, I think that where we fall short is in the management of chronic problems. So many chronic problems are probably far better treated with behavioral changes than with medications. That doesn't mean that medications don't have a place. Of course they have a place, but we can often start replacing medications if we use the right behavioral changes simultaneously. We can often prevent the need for medications if we start using behavioral changes early on. And I think we really have to start emphasizing and encouraging and supporting behavioral changes, because these are the things that really matter in the long term. These are the things that can affect the underlying mechanisms of a disease rather than just putting a patch on the disease process, which is all too often what most medications do. There are examples, for example, diabetes, where many of the medications don't actually change the disease process, but keep the illness at bay. Some of the medications do affect the disease process, but come with side effects as well. So in general, it's always better, if we can, to avoid using medication. Of course, this should be done in conjunction with strict and close medical supervision by your doctor. You shouldn't just be doing this on your own, but there is very much a place for thinking about how we can cut back on the use of medications or avoid the use of medications altogether.
Why do medical institutions focus more on pharmacological treatments than on promoting behavioral changes?
I think it's all too easy to prescribe instead of encouraging. I think that prescribing is often very quick and a little bit too quick. It doesn't take up much time to write a prescription, or nowadays to click on a prescription, but to sit, talk, understand, really listen to a patient and help them to form a plan as to how they're going to make a behavioral change takes time. I also think that a lot of research is focused on the use of medications, because research in itself is expensive. To perform a good study, it costs tens of millions of dollars sometimes, and somebody has to foot that bill and something has to foot that bill. So medications are the answer for that, unfortunately. It's just an economic reality. The mindset of modern medicine is one of seeing results very quickly and also targeting very specific problems. So medications answer usually both of those issues. The problem is that when you have a chronic illness, you don't necessarily need to see results quickly. And what you would far be better off doing is sorting out the underlying problem. So things like sports, eating healthier, sleeping well, having good relationships, these are all things which actually positively impact many chronic disease processes. On the subject of targeting a problem, back in the 1920s when penicillin was discovered, it was realized that you could treat just one bacteria with one antibiotic, and this basically healed the patient, as it were. And I think that this set medicine into a mindset of let's look for targets of disease. So we can actually say, well, this is the bacteria, we'll target that, and then we've solved the problem, which is all very well and good and very important for many different diseases, but I think it's also led us to a narrow way of thinking. So we're always looking for a specific mechanism affecting a specific disease. In olden times, and perhaps more recently as well, we're starting to think slightly differently. We know, for example, that sports positively impacts virtually every disease that there is, including mental diseases and including physical diseases. And without us always needing to understand every small mechanism and every target that's gone wrong in the body, just by maintaining good overall health and by doing the right kinds of sports or dietary changes, we can actually have a very positive effect on an underlying illness process. So I think that this is something that we really have to focus on. I think also that we pay a large price by not addressing the underlying causes of disease and just by treating someone with a drug, for example. Really, there's study after study after study that shows the positive effect that sports has on virtually every disease, whether they are mental or physical. And of course, I would remind everybody here always to go and see your own doctor first, never to just take things into your own hands, but do educate yourselves. Do try to live healthier. Do try to eat well. Do try to sleep well. Make sure you do sports regularly and take ownership of your actual disease, as if you have one, or if you don't have one, then take ownership of your health, because the idea is to be healthier.
Are people in general aware of the importance of behavioral changes?
I think that people don't really realize the power of the behavioral changes in terms of either improving their disease state or keeping themselves healthier for longer. I think that we, meaning society, meaning the medical institutions, pay a lot of lip service by saying, oh, do sport, do this, do that. But I think ultimately people don't really know how powerful these things can be, especially if I think about things like sport and diet, but also things like sleep. And I think it's a great shame because they're very much underutilized in keeping the population healthy. I think the policy changes on the level of government could have huge impacts on health. And if, for example, we were not to just be taxing cigarettes, but using that money to promote healthier living, whether it be through subsidizing healthy foods, education for sports, etc., etc. These are things that could have a very large effect on a population level. So I really wanted to do this video today because I think it's so important that people are not helpless in their own health. I think it's all too easy to say, well, I went to the doctor and he told me this, and either you do it or you don't do it. But people really can benefit by taking ownership of their own health. I think that this is one of the most important factors in maintaining health, in preventing disease, and in improving a disease state. So it's critical for me as a doctor that patients understand this and that they become more powerful for their own health by taking control over what they do. Thank you for watching today. If you've got any comments, please leave them in the space below. Click like so that we know that what we're doing is what you want to hear, and tell us what else you want to know.